All right, I'm gonna call the meeting to order. Before we start, please, again, ask to be recognized for asking questions or. Okay. 2.0 prayer.
Oh, Lord God Almighty, thank you for a beautiful day today. And just thank you for getting everybody here safely. Pray for safe return trip, especially for those that have to travel a ways yet to get back home. Thank you for this time to serve the people of this county, people that live and work at the Stephenson Nursing Center. Pray that you would give us wisdom and discernment, the ability to speak thoroughly and with the right attitude and the right perspective on things. Just pray you would help us work through all the details we have to cover tonight in a way that will glorify and honor you. Thank you and praise you. In Jesus' name.
3.0 approval of tonight's agenda. Do I have a motion to approve?
So moved.
By Mr. Whalen, do I have a second?
Second.
Mr. Meester, any discussion? Seeing none, all those in favor say aye.
Aye.
Opposed? 4.0 review and approval of meeting minutes for May 9th, 2024 meeting. Do I have a motion to approve?
So moved.
By Mr. Whalen, do I have a second? By Mr. Meester, any discussion? Seeing none, all those in favor say aye. Opposed? Motion carried. 5.0 approval of claims totaling in the amount of cash requirements and manuals of $195,556.41. Motion to approve.
So moved.
Second by Mr. Hadley. Any discussion? Seeing none, all those in favor say aye.
Aye.
Opposed? 3 to 1. 6.0 public comment. Please state your name for record and you have 3 minutes. Nope. All right, moving on. 7.0 reports to committee. Sorry, I got jumped the gun here. Administrator's report.
Okay, so today our census is 47. We have 7 skilled and 3 hospice. The hires that we have in the community, we have hired 4 up until today. We've hired 2 CNAs, 1 LPN, and 1 activity aide. We have terminated 2 CNAs. We are working with TCM on getting the policies for the department heads. We are working on the dementia training for the community. We have done 2 parts, I believe, out of a 4-part series, right? We are working on the training for the new hires, the new nurses that are coming on board, and celebrations in the community. I was out in the patio. We were looking at because it's going to be nice out now. So between the activities director and myself, we did get 2 raised gardens so they could grow some vegetables. Those are in the community. One of the residents wanted to help. I said no. So, but we're hoping to have that up and running by next week. It has a beautiful back area where they can push the residents around. The trees were trimmed. There is 1 dead tree that we're going to have chopped down. We bought a hose reel in order for the residents to be able to, participate in that, which is great. That's what's happening.
Okay. Any questions for Adrian? Yes.
I had one. I remember an email here a couple weeks ago. How is it going with the matrix training? Do we have anything scheduled yet?
Well, actually, so it's been a little conflicting, right? Because when I first started back in January, December, and I went into Matrix, nothing really made sense. I have not worked in Matrix for about 2 years. And so I did reach out to Matrix to get a report on, sometimes you have to pay for the extra modules.
Mhm.
And so in the report that they gave me, they explained what was being utilized and what wasn't. So in looking through 3 big binders, everything has to be sequential, because if you don't do it sequentially, then that could mess whatever is already operating there. So, but when I did set up a collections call to go ahead and get something like that set up, then I received an email from TCM stating that they have done a lot of work and that I should not be going in there because, and again, I wasn't going in there. I was just trying to understand what was set up and what wasn't. So based on the reports that I got from them, it explains that what needs review and what needs implementation. So I have all that information here. So after getting that email, I did stop doing that. I have been trying to set up a binder for the nurses as far as matrix training. So I'm a big believer in feedback. So we did hire a new nurse about 3.5 weeks ago. And at the end of her training, I asked her how it was going. And she explained to me that she needed, more training. She hadn't worked with Matrix. So in going through Matrix, each area has a question mark that when you go in there and you say, show me how to, how do I add a resident? So it tells you step by step, which tab you go in, what fields are important. And obviously, they're not, IT people, but I want to make it as easy as possible because not everybody works with Matrix. All the EMR systems are different. Everybody is more familiar with PCC. But again, if we give them the tools to be able to, do their job efficiently, then we'll be able to retain them, right? So I am hoping for some clarity as far as how to move forward, because, based on we're paying, what the facility is paying for and what is being utilized, it's like 5%, 10%. So hopefully we can get that squared away today.
What would you like to see from this committee in that regard?
So from reaching out to Matrix, I do know that they have about 75 hours, banked hours that will be, I believe, eliminated by the end of the year if we don't use it. And so they did make a recommendation of how many hours for each different component it would kind of use. So I believe the clinical side it's 11.75 hours. And then on the revenue side, that is over here. That was like 4.75 hours. So there still leaves a lot of room for, if there's a specific problem that the building is having, then we could, pinpoint that and ask for that specific training.
So would most of this training occur with the business office manager, Jennifer?
With the DON, the business office manager, almost like a train the trainer. So we train the DON, the clinical department heads, and then work into the clinical staff, the nurses. And then Jennifer and admissions is important because based on her putting in the resident, a brand new resident, it's important to make sure that all the information that is pertinent for billing, for nursing, for therapy is put in the right place. So it would be Jennifer and Jeannie.
Jeannie. Is there some reason that we need to hold that up from TCM standpoint?
I don't understand the question well enough to get it.
Well, we have software. My understanding, like I said, we have software that can do a lot of the things that we've hired you guys to do in terms of billing, in terms of patient tracking, in terms of the clinical aspects of the operation. And we've never utilized the training on it. We've never trained anybody out there to actually physically use it, although we're paying for it. So to me, that makes no sense. But if you can't give me a reason that we shouldn't be training these individuals on the use of the software, then by all means, we should move forward with training the individuals on the software.
I don't think that you know enough about the software in general, what it does, how it affects everyone. I think this is a larger conversation. We need our clinical people in the room, we need our billers in the room, or on a Zoom call. It's a bigger topic. You can mess a lot up. When we entered here, the matrix was not being used either. Actually, it was being half used and half not used. And that was part of the mess with billing, because being used, but being used incorrectly.
Because people weren't properly trained, would be my estimation.
It's beyond training. It's turnover. There's so many nuances. Let's even talk about nurses. Forget about billing. Different diagnosis, different codes, things that look alike, things that shouldn't be. We are capable, TCM, of doing a great job with Matrix and customizing reports so that we can streamline things. It's less about the training and more about having a meeting of what do we want Matrix to look like in the future. And moving forward with it.
So then why don't we add that to the Monday meeting and start getting that?
We can do that. We have a team on the call. That's good.
Okay, and then we'll send out, keep everybody in the loop.
So can I say something? Here is the report of what is being utilized. And a big portion of it is not. I don't need this. I can leave this here. But, it is, it's different assessments, different vitals, different, components that Matrix has the capacity to do, but we're not utilizing it. And even though there is turnover, that is the exact reason why you need it set up very simple. So ideally, I would like for it to look like if there is a nurse that we had to hire through agency, when she walks through that door, she knows what's expected, how to put in a new admission, how to check vitals, what happens if the electric goes out, where to print the EMR to be able to pass medications. So it can be done, and it actually should be done, especially because there's agencies still in the building. So as working as an administrator for nursing, it has to be very clear and concise for them to want to do their job. If it is confusing for them, they will not do it, and that is what I've seen. So it's not the building's fault, it's the administration's fault, because we haven't invested the time in making it easier for them. So when I walked in the building and I looked in Matrix has the capability to do a workflow. The workflow, pretty much, if you go in there, then it tells you, what the next steps are. So when I went into theirs, and I can't share this because I do have information that I haven't redacted yet, it shows them a list of this to go in there. That is not helping them understand how to do their job. And so even though I don't want to be the computer programmer, what I'm trying to do is help them facilitate their job so they can do the correct job, so we can go ahead and the billing process is paid. Does that make sense?
Almost any company that I'm aware of in software has the capacity to train in an environment that doesn't affect the real.
Correct.
So to me, that would,
About playing in the sandbox.
Yeah, that's what it's.
right. So that I would assume that's what we're talking about. to get
so
people
multi-level.
used to,
It is,
And
and you're not wrong. Yeah, I'm not saying you're wrong. I'm just saying that you're.
like
service.
any software, any tool you're gonna use, if you don't know how to use it, you gotta get trained on it. So
There are
you
other
gotta start
buildings, we use software A to Z.
somewhere. Understood.
Okay, so
Okay.
it's a good idea
Move
to.
on.
Moving on.
Get on with it on Monday and then start from there.
I get something for the administration for. Historically, in the past, we've talked about some other operational things that may be going on. One of the things that we used to talk about is agency usage. It's since it's kind of going away, we've stopped talking about it. But I think that's the case. Maybe Adrian, could you talk to agency at this point?
Right, we lost 2 nurses, right? We lost one of the midnight nurse and another nurse that were, in the community for years. So being down 2 nurses and looking at the way that how the patient load is being distributed, and the nurses not wanting to pick up, that leaves more holes. The facility only has 3 employed nurses, and I believe everybody else is PRN. So PRN has its, what we require of the nurses, but depending on what's happening in a building, right? I think that we really haven't stuck to those rules of every other weekend. And so that, that leaves gaps. And so even though they are picking up, they're also calling off. And I believe that the reason that there is so much PRN versus employed nurses is because of the wage. We're paying, the PRN nurses more because I know there was a huge need last year. But, again, we're down a wound nurse. We're down IP currently. We're down a midnight nurse. And so the reason that we're requesting more agency contracts, that's not a guarantee that you'll have the coverage for the building, but it was in my plan of correction when we were cited for the PBJ. So if I said that we were going to get more contracts, again, that doesn't mean that they'll pick up, but at least we have more avenues to get from. Right now, the current DON is spending 70% of her time doing the schedule, filling in the holes, and her job is much more than that. So I'm asking for those contracts because we take care of people. And so if you want the census to continue to grow, we have to be able to have staff to take care of them. It's that simple.
So, thank you for that. But there's also, we were talking about PRN, but there's also pure agency, outside agency like we used to have.
Yes.
Where we're at. Usage, dollars, anything like that?
Actually, Kendra sent a report over to Jennifer.
Yeah.
No, I do not know.
I happen to have some numbers here that came from Jennifer. Okay. For the first quarter, there's virtually 0 agency. January at $1,300. April then we had 0 for February, 0 for March. April, we had $3,275. In May, we jumped up to $15,163. And in June, through 10 days of June, anyway, we have over $10,000, meaning a $30,000 base. And I've noticed that the payroll's been going up and the agency's been going up. Doesn't quite make 100% sense. So just could you talk to that? So.
Well, we currently do not have a wound nurse. So we do have one of the PRN nurses rounding with the wound doctor on Mondays. She's doing the report, and she is also covering infection prevention. And so that would be the PRN. But again, losing a wound nurse, losing the midnight nurse that steadily, she did 5 to 6 shifts a week, that opens it up. Midnight shift is the hardest shift to cover. And so 2 times, if not 3, the director of nursing has had to work the floor. So I don't want to use agency either, but you can't put revenue costs in front of taking care of the people. So then based on your census is how you staff your floor. And so again, it has to be safe. Not that I want to use agency, because we did hire an LPN, and I believe we've got another 4 nurses sometime this month, if not the beginning of July. Is that accurate?
Yeah.
So it's not going to be forever. And I do appreciate TCM recruiting the nurses, but so that's why the training is so imperative, because we want them to work and know their job and it not be ambiguous to try to figure it out.
Okay, any more
So you
questions?
would, yeah,
Sorry.
it's one big topic, kind of.
Okay.
So you had mentioned wages before.
Yes.
It sounded like you're not happy with the wages, that we're not competitive, but I don't want to put words in your
Well, no, what happens is, so there was a need for nurses and you put a PRN wage out there. So I look at that wage as a cash comp, right? There's no benefits. And so they're being paid just their salary. But you also have department heads. So, I don't know what they make, right? But that also has to be competitive. If, I don't know exactly the salaries that went up, the payroll, but I could definitely look into it. But we are trying to utilize more of our staff to fill in the holes that, came open. Like I said, the DON has been hitting the floor. We have nurses that don't work the midnight shift, picking up on the midnight shift and trying to come up with a different way. Maybe they don't have to do 16 hours. Maybe we could do 12 because that is a long day for them. But the director of nursing is spending 70% of her time doing the schedule. So trust me, we don't want agency in there, but we have to be safe and take care of the
So
rest.
what about CNAs? Wages and hiring new CNAs in.
So we're short. Once I did the calculation, helped Annette to be able to calculate the staffing that was needed. I think I put it in an email. It showed that based on the acuity in the building and the number of residents, we needed 6. We were scheduling 4 to 5, and that's 1 going out on appointments. And so that shows me that, we weren't appropriately staffed, and that's based on the bare bones of the requirement to be in compliance and not to be, on the naughty list, right?
But I'm just talking about wages. So for CNA wages, it appears that we're not able to attract new CNAs at the wages that we agreed to, maybe in the union contract.
Well, I think what happens, right, when you offer a lower wage, you're going to get probably a brand new CNA maybe. And so that's going to require more training. I do know that unfortunately, it is not, the competitors are offering a lot more because they have applied for those grants, but those grants are going to end. And so it's a process that if the county wanted to do that and apply, I don't know how long it takes the money to come in. And so I agree. If we can't match the wage, then we have to be able to offer something in return. And so in my mind, if we can give them a clear understanding of what their job is, how to do their job, staff appropriately, all with holding people accountable, then the money is not so important as much as their job and, feeling appreciated, right?
So let me throw a couple things at you. Let me know if you agree.
Is this the last? No.
I got some things too.
When the union agreement was renegotiated, and let's just talk about CNAs.
Okay.
Simple. Okay, one time. There are bonuses, pickup bonuses, bonuses upon bonuses.
Attendance bonus.
Yes, I think we pay like $5,000 or so bonuses. What if we were to be able to go back to the union, not increase the dollar spent, but change the bonuses, eliminate the bonuses, or greatly reduce the bonuses, but throw that extra money into a higher starting wage? You think that would help? So what I'm saying is if CNA is making $15 an hour and $3 an hour in bonuses, move it to $17 an hour,
Mhm,
$1 an hour.
mhm.
You think that would help recruiting without spending extra dollars?
If you switched it, it could, because unfortunately, even though there are all those added bonuses and it does impact their wage, almost $4 an hour, I think people are fixated on the amount that they're making versus the overall. And I'm assuming that the reason that they put the bonus in place was because, if they don't show up for work and we go ahead and provide the bonus and they call off, well, now we're back where we started, right? Trying to fill the shift. And so there has to be some accountability. And so I believe that we're rewarding them, A, for helping the building, and B, for coming to work and not being part of the call off problem. So, I mean, I think it could make a difference because they're paying it regardless right now, right?
No, I would agree too. And people like to know what I'm making X per hour, even more than I'm making less, but I'm getting more in a bonus.
Right.
I've seen that throughout history. And so we would like to recommend, again, it's not on the agenda, so don't have to take any action on it. We would like to recommend to reopen the wages for the contract that was just negotiated and work something out with the union without spending any more money, just shifting dollars.
Okay.
So maybe it'll be we can put it on next month's agenda. But meantime, think about it.
Mr. Henley?
Just to follow up on something with Mike. We don't have any language in the contract that if we bring in an experienced CNA, that we can give them a little more. Because I know that we have contracts for that kind of stuff at other, through our county.
I don't think I saw the language for experienced, and I think if you start somebody at a higher wage, I think that would bring upon a grievance, and then if it's a higher wage, then they could go back and say, because of, now how is that fair to everybody else, right?
I understand that, but that's something that we should probably look into. Other contracts have that kind of language, that other municipalities and counties and different agencies and stuff like that, where they bring somebody in experience, so they can pay them a little more. That's something we look into. But this brings me to a question. I believe this is the first county facility you ever worked at, or?
It is.
And have you worked at facilities? I know the private sector has unions. Have you worked at many facilities that had unions?
Yes, I have.
And, the grievance process has to be done in a timely manner and stuff like that.
Yes.
And if it's not done, we can end up at the labor board, you know, somebody can file something with the labor board. How familiar are you with our contract with Ask Me? Have you sat down? I know you have many hats. Have you sat down and actually read our up-to-date contract?
I have read it with HR when the new one was approved. And so, yes, I have read it.
Yeah, you know that we have a union labor attorney, you know, a
Yeah.
labor attorney, Lone Bob. Have you ever utilized him, talked to him about any issues, to
I have.
familiarize yourself and stuff like that?
Yeah.
Okay, that's all I have. I just wanted to find it. Thank you.
All right,
Can I
moving,
ask one last question?
okay.
I'm sorry, but I was just looking back through the P&Ls, Mike, and it's,
Yes, I got
The-
it.
no,
Okay.
I'm just, it relates to the comment that you made earlier about payroll. And it's pretty consistent. I mean, January was 209, February 186, so we had a drop there, 211 in March, and April was up to 220, so there was a bit of an increase. And agency was kind of $3,000 a couple of those months and nothing. My question is, what was the census? When you started, it was under 40.
It was 39.
And so that was up to 55.
I think we got to maybe 53,
50 something.
54.
Okay.
Mhm.
I mean, there was a need there to add some extra personnel.
Right.
But
Yeah.
due to that, I just wanted to clarify. Thank you.
Yeah,
Yeah,
yes.
so if people aren't remembering, we just ratified the contract
Mhm.
just recently, and there was back pay, which is part of the reason why payroll went higher. We had to go all
Thank
the
you.
way back to January.
Last time.
So the payrolls, let's say before January, were 93,000. The payrolls today, no back pay, anything. about 105,000. Now, that being said, a little higher census, good point, means a little bit more staff. About a, whatever, 5-6% increase means a little higher payroll. So you might be able to get from 93,000 to the 105,000 with those variables. But now add 30,000 in agency onto that. That's my point.
I know we're beating it up first. Another increase, there was, and I don't know which payroll this hit, but there was a significant increase in the DON salary. A couple of the other department heads that are newer, those were brought in higher than the positions, the people who left the positions. That attributes some as well.
And we had a bonus for the person responsible. for
Yeah,
bringing people in.
the census bonus for marketing and admissions as well. Yes.
And I did hire a medical records person.
Okay, moving on. 7.1.
I'm sorry.
Yes,
I would like to add to the administrative report every month. We kind of got away from that and Mike reminded me, we talked about agency and we got away from agency, so we didn't need to talk about it. But we typically talk about IDPH, any updates, and I know we did have a complaint this past month. So just kind of making sure that we update that, as well as any union grievances. And I know we did have a union grievance as well. So I just, making sure the committee's up to date. I know that you and Georgia are, but typically we have that on the agenda. So if that's something that people want to hear about here, we can make sure that we
Yes,
got that on the administrator's report.
we did have 2 complaints. IDPH came in and there was no findings, and so everything is closed. We do have a union grievance. I did communicate with the attorney, and so I think I'm just waiting for them to send over the paper.
They need to do tomorrow. Response.
Okay.
okay. 7.2.
What time? Oh.
Sure.
Okay, the April P&L shows a profit of 25,000. That was based on a census of 48. What that 1,454 days comes to. It's a sidebar. We did file the 2023 cost report for Stephenson County Nursing Center, Stephenson Nursing Center. That cost report does show an $816,000 profit for 2023, which is actually more than we had projected. We had projected 363, but that was without 400,000 in money. So our P&L is 763. Whipley's was 860. Whatever that means, I'm not sure. We're confident that our number is right, but came in higher. I'm not sure if there's any questions on the P&L.
Doesn't look like it.
Let's go to the cash flow, which is pretty much like broken record for the last few months. We're going to struggle with certain things till we get the tax levy in October, hopefully, and starting next month, we should get about $50,000. We're not even to pay the liability comp insurance. It'd be paid up in full, at least for 4 months or so. We do have a couple large dollar amounts that are still hung up in the Change Healthcare Act. Remember what that was all about. There's like a $112,000 payment and $124,000. Those two would be nice if they're in our bank right now. No fault of anyone, they're not, but they should be 2 to 3 weeks from now. They should be hitting the bank. It's a little bit older money that we collect. Any other questions? Yeah. Let's go to AR. So I didn't forward this, but I can, especially I know. I did a analysis of every county-owned nursing home in the state of Illinois, plus the 4 closest privately owned buildings to Stephenson County, and looked at their accounts receivable at the end of every year versus, their accounts receivable every year, their outstanding accounts receivable compared to their annual income, the amount they bill. So, like if a building billed $4 million in 1 year, the conclusion was on average, and there were some ebbs and flows between different buildings, but 25% of what is billed on an annual basis is what these 20 buildings combined average is having an outstanding AR. So, for example, we billed $6 million last year, 25% of that would be 1.5. Our AR is 1.3 million. So a little bit ahead of the curve there, but it just goes, and what I'm trying to do, and I've been trying to say, and I have said actually for a year now, is that where our AR is in this industry norm. Challenge anyone who wants to have a conversation with me. And so I believe that our AR is completely normal. It will continue to be like this. There's absolutely no way to catch it up to 100. It's not physically possible, not the way the business works. So I will forward you that analysis. You can take a look at it. It's got the names of every building and you can see statistics. Super. Aside from that, Mr. Whalen, you had another question about Meridian. Because there's some negative balances in here that are pretty.
Well, if I may. Yeah, when I look down the report, I'm looking at April, just going down that list from April before, you've got 1, 2, 3, 4, 8. And entries here that are parentheses, and it shows at least if I remember right, the paperwork prior, we were at, I know there was a discrepancy too from the matrix, from an entry or something like that. So it was about 180 if I remember right. But what do those represent? I mean, do we owe Meridian money? Or how is that factored in here?
My guess is we do owe Meridian, but in talking with our AR people, it's like $10. Meridian, if you notice, is like the only one that's really in negative brackets here, and they have messed up their billing so badly. So we are entering what is on the books, but it's not accurate. Meridian owes us over here, and we owe them over here. Is pretty much what the general work is there. And so most of it is offset. So it's showing differently, but most of it is offset. There probably is about 10,000 of an overpayment in there, which goes back way to 2021, 2022.
And
It's not sorted out yet.
on the report, it's showing we owe them $100,000 on the outstanding balance.
Right. And I'm saying it's not accurate. But the whole number that you're looking at, or the bottom line number is accurate. But I am saying that one line item, we don't owe 100,000. We do owe about 10.
Well, but how can the bottom line number be accurate if that number isn't?
Because there's other dollars these are overstated. There are other columns that are understated to offset 90% of that 100,000.
Okay. I look forward to seeing your report. Thank you.
So we had other things. We had submitted an amended TCM contract to the board, which didn't make the agenda tonight for some reason. I'm not sure why. But we do need an answer on it. So to really just, cut to the chase, if we are allowed to do what we're allowed to do in that signed contract, then the contract is fine as is. But if you're not going to allow us to do things that are in that contract, then we need to eliminate the things that you're not allowing us. And having it a hybrid in the middle is a liability to both the county and TCM. So we need this addressed. How do we get it addressed?
Well, I spoke with the chairman and the state's attorney, and there's a contract in place. And parties, there's remedies within it, and if there's both parties agree, don't like the terms.
We're not saying we don't like the terms. We want to abide by the terms. This committee is not allowing us to abide by the terms. So
How so?
we are supposed to be overseeing the administrator. We're supposed to be allowed in union negotiations. Shut out. Everything that I blanked out in my amendments are the things you're not allowed us to do. Some of them are okay because it's like purchasing insurance. Probably never should have been in there in the first place. But the main one is we have lost control of that building because we're not allowed to oversee the administrator. We have no decision-making power. It's been stripped from us.
So you're saying there's no collaboration between you and the administrator?
Correct.
Because the way I read the contract, you are under our authority as a committee. And if we're okay with the operation as it is, then that should be okay. I don't understand what the problem is.
I don't even know what that just meant. I don't see that in the contract.
You are hired by this county
Agreed.
and you report to this committee.
Not necessarily.
No, you report to this
Report to
committee
the
in that
county.
contract,
Report to the county.
which the county delegates that authority to this committee. So, enough said.
And so if you were to say
If
stop,
you're not happy with that relationship, then it's up to you to do something about it. It's not going to change.
Okay, we're gonna move on.
hold on, one last thing. Yeah. Copy for everyone. Sorry, it wasn't in the package.
I have a copy. Thank you.
This is an email that I sent Adrian asking for.
No.
If you look at, I have the floor.
To Jennifer.
I sent it to the nursing, you were copied on it, asking for a report. Adrian's response is, LOL, he is mad at me because his team is getting bombarded with emails. Buddy, I am making sure you are getting your money's worth. So Adrian, who are you talking to? Obviously, you weren't responding to me.
So you sent, may I speak? I had met with one of the new nurses and I asked them for feedback on her training. So that developed this list here. I don't know if it's events or observations, right? And so again, I think you had sent that email regarding if I'm going to take over IT. This is not taking over IT. This is explaining that the building has a need and this is what they look at, right? And so I sent an email that looked exactly like this with all the different assessments or nursing templates that I needed for the nursing team to be able to not have to guess on what to document. And so that leads me to this. So the billing is not just we generate the bill
What
and
does that have to do with the email?
oh, it has everything to do with the email.
Cut to the end, I don't think.
Well,
Who was
so-
it to? Who were you responding?
well, so what had happened is you emailed Jennifer directly. We were trying to get something done and I was helping with the AP because that in itself is a bit time consuming and you wanted all the invoices for all these vendors, even though we generate a CIC report that shows all the outstanding bills. And then we get an email from the treasurer that states everything that has been paid. So I don't understand how printing all the invoices for this would help generating the profit and loss because all that information is in that CIC report. And so I don't want the team to feel intimidated or feel like, they're doing anything wrong. So I responded to Jennifer, letting her know that the reason you were asking for all this was because I, in turn, was asking your team for different help with Matrix. That's what that email meant.
Okay, so we're gonna move on to old business.
I got things to ask Mike now, please, Chairman. Don't rush the meeting here, just, let's take our time here. I have questions. Jeepers. So, where are we at with this group interviewing?
We put forward two candidates. And we were told one of them is not eligible. The prior administrator. The reason we were given is because she left. And then the other person that we put through, we couldn't get an answer in an expedited type of meeting. We lost him now. It's like banging your head against the wall.
So one person, Scott, probably should not have said his name, but he's from Colorado. He needs to be, I wanted an in-person meeting. We contacted you on Friday after I got together with the hiring committee to give you some time to get him here.
Which is so unreasonable. His roots are in Illinois. He has a job out of state. He's going to fly in at his expense. He's already been burned once by you guys. And so
Actually, he wasn't. He was interviewed and accepted a different position.
So, well, I hope you're right, Adrian, because I'm going to FOIA your emails because I don't buy your story for a minute. I believe you're talking to someone at this table and you're getting direction from someone who is not us. And that is not abiding by the contract.
So in my email to you guys on Monday, I said that I would want to be copied on everything to the team. So you can imagine how it is for them, right?
You
In
were
most,
copied on this.
no, but so the AP and the business office is very busy. And so now to pull all these, and so that's why I am trying to help her with whatever I can. And so when I see that something is not making sense, I ask questions. So ideally, this should be a great relationship because we were able to bring up the census. I have mentored the team and I have helped the whole time. So billing is not just they get in and we get paid. It's a whole process. So I've given the team admissions, the business office manager, different websites to get additional training. And so this pictures, I like pictures. It explains the whole billing process. And so when I
I don't
talk
even
to,
know why you're involved in the building. You have so
Well-
many clinical issues to take care of in this building. You have a shortage of employees. You've raised the
Well-
agency up to 30,000 again.
and
which
based
puts-
on your
which puts us
contract,
at
you have
risk.
oversight to all of that, right?
No, you can't oversee someone who won't be oversaw.
Okay.
With the phrases.
Any additional
They're extremely
Mr. Mallon?
I've still got another question. And, the next question is, what do we owe you and what is the interest rate now?
Currently owe 386,000. Which would mean every month it's 3,860. Since we brought it up 2 months ago. Said the numbers right with them. You won't need any new ones because we haven't been paid in the last 2 months. And I wonder why that is. Someone is saying, don't pay TCM. It's the only explanation.
I,
I don't know who that is, but it's only a handful of people that have that authority. It's not hard to get.
So every month or whenever we get money, right, we have to prioritize the bills based on the vendors cutting us off or based on contract expectations. So the current therapy provider is leaving. And so when I spoke with your team and they reviewed the contract, they made it very clear that we want to make sure that, they are a priority of the list. Cleaning products are a priority of the list. The pharmacy is a priority of the list. And so there's not enough money. And I believe in the last meeting, I believe in what I do, and my job is the voice of the building and what the needs are. And so, yes, we have clinical issues. Yes. And based on what we're utilizing of the software, it's not happening. And we get calls every day regarding different payments, emailed. It's got its own email. So it is a bit overwhelming at times. And I want to work with you to facilitate the claims being paid. And so I believe Monday or Tuesday, part of your team was there to go over PDPM with the team.
For your request, right?
Yes. And I gave feedback. I emailed it and I said that the team thought it was very informative because since the payment structure has changed, the capturing has changed, everybody needs to be educated on, we should be getting credit for the work that we're doing. If we don't capture it, then we can't bill for it. It's fair. Doesn't that sum it up?
No, it doesn't, not at all. So number one, you weren't at that meeting that you implied you would be. You weren't in it at all.
I was,
Tuesday.
right, I was not feeling well and I wanted to keep.
Second of all,
everything.
we had talked about, and you even sat here and asked the question, The county is not reimbursed the same as the rest of the state. We've gone through this. You even regurgitated it back to us. And shouldn't we be doing X, Y, and Z? So the PDPM, although it is important for documentation, it has no bearing on the billing except for Medicare patients,
Right, and
which is
that's
5, 6, 7 people.
7. So 7 people, right? And I meant only for Medicare. So is there a pay for service though? So their Medicaid doesn't get, it's always a flat rate, correct?
Medicaid is cost-based in Illinois. You actually had some good ideas of how to have some creative ideas around that. You've forgotten it by now, I don't know. I'm actually impressed when you had those ideas. But the county has not embraced those ideas. Maybe if they came from you, the ideas would be great.
My job is to help the building do the best job they can, so it makes your job easier to collect.
But we need an administrator that's
agree?
in the building.
And I agree with you. You
You're
need
not in the
somebody.
building enough.
Okay, well, and I also have a 2.5-hour commute, and I want to help as much as I can. I am not their permanent administrator, but in the time that I've been there, we have raised the census to 53, 54. We have been able to identify issues that we need corrected, right? We have hired a medical records person to be able to attach the documents to have a focus on where everything should be, which is attached to the medical record. And so I did go through your annual and your life safety. And so I am trying to do the best I can for the building and for the team. That I am not their permanent person, but I don't think it would do anybody any justice if I didn't state what the issues are and what we need help in, or what we need clarity or education or training. I mean, I don't know what the previous administrator did, but that's my job, is to help them do theirs. That's it.
It's our job. And you
Mr. Hadley,
keep saying
did they
it's
answer any
your
of your questions?
So I got one final thing, one final thought is that, in reference to this, email that was produced is, we should not be airing grievances out in a committee meeting. I believe that we need to be in executive session. I have recommended to the county board chairman that we go into executive session at this next meeting in reference to personnel out at the nursing home, and invite Mike Flippo and his group and the interim administrator there to get this problem fixed. Apparently there's a problem, even by this email disturbs me too. So we shouldn't be airing this out. We should be in executive session. So I recommend that we go in executive session to the county board chairman on this issue. That's all I have.
8.0 old business, discussion and approval of agreement or discussion and approval of agreement with Markham. We did receive the letter from Sickage. It was all in your packets. So hopefully we did not hear back from Whitley yet, but at least we have Sickages and we'll record it. 9.0, actually new business. 9.1, approval of the bid of the HVAC rooftop replacement units at Stephenson Nursing Center. Seth did provide his recommendation. Do you guys want to, Kurt, have anything to say? You guys want to add anything on that?
No, we agreed with Seth's recommendation for Loescher. It was the most reasonable bid, local provider. Helm bid was, I think, almost close to double. And the other provider was in line with Loescher, but they were out of Rockford. We had not familiar with them. So I think Seth did a nice job recapping, and we're comfortable with Loescher.
So do I have a motion to approve?
motion to approve the bids for Measure.
Do I have a second?
Second.
Any discussion?
Yes, I have some discussion. Very happy that we got 3 bids. I wish we could get 3 bids all the time, because this shows me that, Helms, now, I guess my big question is, did everybody take a walkthrough Did Lushers, everybody take a walk through, looked at all the units?
There were actually 4 companies that walked through and only 3 presented bids.
Actually, Seth, the maintenance guy, took them through.
Yep. Up on the roof.
Showed all the units that need to be replaced. We estimated about 200,000 for this project, but it's coming in, way lower than the 200,000, but it's all the units, right? That we had told them that we wanted done. I thought it was 8 units and I kind of read that they're like 7 units.
Yeah, it's not all the units. 3 of them had already been replaced or repaired, so it wasn't quite all. I don't know the number off the top of my head, but
So they
Seth
all,
was comfortable with the proposal.
bid it on the same
Yep.
removals and everything else. And I'm happy that the local company was the lowest bidder, but this just shows me, we just got done awarding a contract to Helms Group and, if other people had bid it on it, maybe we would have saved a lot more money for the county, but I'm happy too with this bid, so.
Okay, any further discussion? Seeing none, all those in favor say aye. Opposed? Carries. Approval 9.2, approval of RFP for therapy services. I know you guys stated that the current one gave their notice.
Nope, I have got the letter right here.
Good. Do I have a motion to approve?
So moved.
By Mr. Whalen, do I have a second? By Mr. Any discussion? Okay. Seeing-
Oh, yeah.
I was gonna say, I think Denise has some
Yeah,
information.
yes, can you?
I didn't bring it with me. So with the RFP being open for 30 days, it would not allow it to come back for approval in the July board meeting date if we had to have the bids in prior to nursing home committee, I think,
Yes.
sitting in front of me. So my thought was when Denise approached me about this, because on the August meeting would be after the current company wouldn't allow the right turnover time, is if the committee would give a consensus to allow those bids to come in and go straight to the board as opposed to coming through the nursing center committee, because then we could have it open for 30 days, have a summary and a recommendation available for the board meeting. It just wouldn't be in time for the nursing home meeting.
Is there a consensus?
I'm good with that.
So that's what the dates are. They're reflected in the draft that you have.
Mr. Hadley?
That's fine, I'm
Okay,
fine
you
with
shook your
that.
head, huh?
Yeah, I'm fine with that.
Okay.
Trying to get the 30 days and
Yeah, thank you.
prolong the process.
On all for 30 days.
Okay. All those in favor say aye. Opposed? Motion carries. Approval of agreement with Grape Tree Medical Staffing. Yeah,
I read through there. There's 2 things that we might need to change. Number 1, the payment terms are 30 days. I'm not sure we can do that. And number 2, they're only giving us a $5,000 credit limit. There's something in there that says if we have good payment history for 6 months, then they'll raise it. We use them. We should have good payment history for 6 months. So we should probably get that credit limit changed to something more reasonable. 25,000.
We can reach out.
Okay, we can reach out to them. Okay. Do I have approval motion to approve?
I just heard we were gonna make some changes.
How would I?
They have at least 45 days.
Okay. We will postpone that till next week, right? Or how do I don't know how to.
So if we can have that changed, then can you send that to the next week?
Someone can make a motion.
Yeah, I can make all right, I'll make a motion with those recommended changes from Mr.
So
45 days, payment terms. What was the other one, Mike?
25.
Credit limit 25,000.
Okay. Do I have a second?
Second,
Any discussion?
yeah, Mike, I thought we still had a contract with Great Tree. When did we, it hadn't been, when did we dissolve that contract?
So it was never dissolved, but because it wasn't used for over a year, they needed an updated contract.
Okay, yeah, because I thought we
Which that
had.
doesn't make sense, because we've used them in this past year.
That's
Even-
what I said.
Well, and even this contract, I don't know if the old one looks like, this contract says, that it will be a perpetual contract until one side gives the other 90-day notice. But the first one says the same thing, then we'd have a lot of contract and wouldn't have to do anymore.
And did our state's attorney look this contract
He
over?
did.
And he's fine with it. He didn't talk about the 45 days, billing and stuff.
I think he said something about
Uh-huh.
kind of,
You better get us 6 months.
That ain't gonna happen. Company like that.
We got a motion. All in favor, say aye.
Aye.
Opposed? 9.4, discussion on updates made by S&C handbook. I know Olivia and Kenda's been working on this. Insight on the why there's changes or anything like that.
There's quite a few edits to the handbook that they're recommending. I don't have a summary for you.
There was a version emailed out that had the old one and the new one so that you could look at them. So
That
Yes.
brings me to a question. How could we get a copy like this, when the state's attorney does changes, he lines it out and then could we get like one clean
That was
copy?
that was actually what was requested from Mr. Hart, and
Okay,
it's not my document. So
okay. Is that possible that, we cross out something, we add something on the bottom, so, we don't, instead of, put one by each side and looking back and forth, because it would make it much, much easier for the board to look at that and, I mean, me personally, I like to see it that way, Is that possible, before the next meeting or something that?
Should be.
Yes.
Yeah.
I mean, and then it'd be more easier to discuss,
Yeah.
I'd like to lay this over to the next meeting, so we have a copy.
It's just a discussion.
Okay,
I don't know. Check. There was go ahead.
I have one or two things quick. One on item B, chain of command. Number 1 is interim administrator. I'd like to change that to administrator in parentheses interim or.
How about just acting administrator?
Or
That was one of the changes.
Legally, whatever works there, but I'd like to. get
Which one was
interim
that?
out of there.
Which one? I'm sorry.
Just on chain of command, item B, it says for number 1, interim administrator. I would just like to leave that as administrator, whoever is the acting administrator at the time.
I agree with you on that. I caught, that's one thing I caught too.
And then,
Acting is one.
can somebody explain to me hang on, I gotta get down to it, 'cause I wanna- what is nesting while on shift? Is that like taking a nap?
so
Basically,
it's,
I figured that was the
this
term.
is falling asleep on the night shift.
Yeah, okay, gotcha.
But if I go down the
Assume that was-
hallway, I go down the hallway and I go into a corner and crawl up in a ball.
I don't like assuming
That's it.
things.
It's intentional versus non-intentional.
Gotcha,
That's things intentional.
thank you. That would not be good.
Any more discussion? Yep, sorry.
There was, after I saw them both, is it possible to have the acknowledgement as its own page so that it can be ripped out and put in their file, or do you put, I mean, that way you have it on record?
Yep.
Budget, yeah, posting notes are down. It refers to the regular 80 hours and 10 days on page 8. But part-time is 8 and under 60, so should it be 60 and up, 8 and 60 instead of? Page 26. The retirement. It currently reads works over 600 hours per year.
Yes.
It should read for tier 1. Tier 2 is 1,000 hours a year. I think that's all I have. Sorry.
No, thank you.
I got a follow-up question, to, Georgia. Me remember some, when we did the handbook for the county and finished that up, didn't we send it in to our liability people to review?
So yes, this was sent to liability. Jane May is who helped us with the county's handbook. Because the collective bargaining agreement reflects that the handbook will be updated to reflect every contract, we had Mr. Lowenbaum look it over and he was fine with.
Okay, so we got somebody looking this over. And that was gonna lead into my next question about the labor contract, you know, that we have and everything, so.
And I was gonna say, I know it's good that the committee is seeing it and looking at it. I just have known that the handbook has been updated every time. Usually when the collective bargaining agreements are renegotiated, it's updated. And I think it's just updated and the committee never sees it. So it's good that everyone's laying eyes on it.
Good, thank you.
9.5, discussion of strategic planning focus areas. So health and social services in partnership with the county health department and 708 board. Mr. Holmes, would you be able to kind of, I know what we did in planning and development, but what was, because 708 goes to court services.
Correct.
So I don't know what they decided upon last night or what was talked upon.
Well, I don't know that there was anything necessarily decided. The point of this is to give the oversight committee that these subcommittees will ultimately report to the opportunity to look at key factors and the measurables to make sure it fits with what the oversight committee is good with. If not, they can make changes. Georgia will get dates out to the individuals that volunteered to be on the subcommittees to meet and discuss this. I honestly don't see there being a whole lot of changes to it, but it's of course open to change. It's a living document that can be, changed according to the members of the subcommittees and the county board. But we just want to get the process started, getting the subcommittees to meet. Georgia, do you know who's on subcommittees for this one?
Subcommittees for health and social services is Jim Hart and Casey Anthony. And for department heads, Terry Whipple.
We don't have to do anything. It's just an opportunity for the oversight committee to discuss if they'd like. But ultimately, the subcommittee will be reporting back to this committee.
Okay. Does anybody have any?
I think if I believe we discussed it about the 708 board, I thought we were just going to, it was fine just to leave it in the nursing home here.
Yeah,
It is.
the conversation, if I recall correctly too.
Yeah.
It's not going to report back to court services necessarily.
Yeah.
It was just because so many social services are involved through the court system. Meeting, see the information.
This is good.
Anybody have anything? Nope. 10.0, public comment.
Oh,
Oh, boy. Please state your name. You have 3 minutes.
Minutes. Jim Hart, District D. Was going to mention also 708, but 708 doesn't report to any, so it doesn't belong anywhere. In any event, I was over here yesterday, and which was a question I had too, Tim. In listening to this, and I'm sure anyone that's watching and listening would be dismayed by this whole meeting. And what I mean by that is the thing that comes to mind is a house divided within itself cannot stand. I know that's what we're seeing here, and that's what we have to keep saying. Separate people and personalities from the issues and problems. I just think we'd be leaving to work on. Specifically here, I think Adrian's a very nice person. I think she's trying to do her job as she sees fit to do, and I appreciate that. Same with TCM. I think they've done a great job. So, but it's quite clear they cannot work together. I mean, that's obvious. This just demonstrates vividly that this does not work. The answer to that, at least in the immediate future, is that one of these entities is a temporary entity for the county, one of them is a permanent entity. That could change. But TCM is not a temporary management company or consultant. I don't know why you're looking at it like that's not accurate. The administrator is certainly an interim temporary administrator. And I know she doesn't want to do this forever because of her geographic location, and probably because it isn't the most pleasant duty she's ever pulled. But she's already been here. We're going to be going on half a year. I think we need to get a permanent administrator in here. I didn't understand about not bringing someone back because they left. That was a temporary administrator. Because that administrator seemed to be able to work with our management company and things were going well, in my opinion, under that. Again, it's not personalities, people to me, not at all. If I thought TCM were doing a bad job or something wrong, I'd advocate for firing in a half beat, and I like that. The same with any administrator. So I think we got to get off of this, favorites and people and personality stuff and get down to the business that we're supposed to be here for. Let's have an administrator and a management company that can work together to move forward. So, just an observation. Thank you.
11.0 adjournment.
So moved.
Anyone, do I have a second? Ms. Jackie, any discussion? All those in favor, say aye.
Aye.
Opposed? Good evening.